Thank you, Devin. And have you ever left a medical appointment forgetting to discuss something with your provider? I know I have. Well, you're not alone, and here to give us some tips on preparing and having a good appointment is Nurse Christina Paris. Thanks for joining us this morning.
Hi, good morning. Glad to be here.
Yeah, glad to see you as well. We've both returned to the Nurse in the North. Always a pleasure. And this week, certainly topical.
Right.
Because, I have definitely gone in and, I hit the main points.
Right.
And then I forget things.
Right. I think most of us have. It's pretty common.
It happens.
Yeah.
So why is it important to prepare ahead of time for these appointments?
Oh, for that reason, for one. But I think medicine is changing too. So we're more patient-centered care. That's what we focus on. So that means what's important to you, not necessarily what your doctor thinks you should be doing, but what's going to work for you. For example, some patients don't like to take medications. Well, you need to be upfront about those kind of things with your doctor. Also, there's different types of appointments you can have. You can do virtual appointments now. I know Marshfield Clinic does them. I know that the VA does them. So sometimes if getting to the doctor is what's holding you back, don't, because there are some virtual appointments that you can have too. And then there's just so many things that we try to keep in mind and we try to think about prior to our appointment. And so, yeah, deciding on those key questions are really critical. So making sure you write them down, the things that have really been bothering you that you want to make sure that you tell your doctor. And also the last little bit that I want to say here in this is that doctors don't have the time like we think they do. So you're really going to have more time with the nurse than you will with the doctor. The doctors honestly get like 10 minutes. That's it. 10 minutes goes really fast. In fact, our segment is usually half of that time.
Yeah.
So, that's really a short amount of time to have these important conversations with your doctor. So make sure that you're organized and ready.
Yeah, that is a good tip there. And speaking of tips, I hear you got about 13 of them for us. So if you were, going into an appointment anytime soon, this might be something to keep on hand.
Right, absolutely. Right. So as we just mentioned, you want to get prepared. You want to make sure that you keep a diary of your symptoms. You talk about these things, know the reason why you're going. So if you're going for your physical, which you and I just talked about how we had to make those appointments. So if it's your annual physical and maybe there's not much going on, that's okay. Just go and have them just check you up give you the once over, check your labs, things like that. But if you do have a reason, so if you're going for an acute appointment, which you can make between your physicals. So some people will say, I have this going on, but my physical, I'm not due for my physical for another 4 or 5 months. It's okay to make an acute appointment. So go ahead and call your doctor with that specific issue that you're having to have that conversation. So know your past medical history too. Sadly in healthcare, especially up here in such a rural area, we do have high turnover with our providers. So these providers aren't necessarily going to be really familiar with you. So know what your past medical history is. If you have thyroid disorder, if you have allergies, if you have heart disease, know those things. So keep a record of your diagnosis. Also bring a friend or somebody with you too who maybe can help you. If you forget, it's always kind of good to have somebody back you up. Know your medications. Make sure you write down your medications, keep a list, and bring those with you to your appointment. And if there's medications you are not taking, make sure that you tell your provider that as well. And if you're having symptoms that could be related to a medication, another good reason why it's important to bring that up to your doctors too. Discuss any current health problems. Don't be afraid to bring things up. Doctors have seen it all. Believe me, nothing you say is going to embarrass them or make them shocked or think any less of you as a person. We've heard it all. We've seen it all. It's important. You need to bring those things up. Computer medical records. Many places have those. Make sure you sign up with the computer medical records so that you can keep in touch easier with your doctor. And then take notes. That's really important because studies show we only remember 10% of what we're told.
Yikes.
So if we take notes during your appointment or maybe right after your appointment, go sit in the waiting room real quick can jot down notes that you talked about, like if there's medication changes. Those are really important. We'll get questions about that. Patients will call and say, I think I was supposed to hold this medication. I can't remember. So
well, there you go. All good tips, you know, for heading into the doctor's appointments. I know, like you said, I know we got to get our physicals. I always forget, but I get there eventually. So it's the annual physical. It keeps on getting like one. It's like a year plus a month.
And
it just keeps going on like that.
I'm impressed that somebody your age is keeping up with your annual physicals, because oftentimes people won't. And that's another big thing. Make sure you do go in annually for your physical. If that's the only medical thing you need, even if you're feeling great, it's always good just to make sure the medications you're taking are still appropriate.
There you go. Plus, it's always a calming experience. Usually, I like the quiet office rooms and the doctor's 10 minutes. I'll eat it right up.
True. Just a few minutes to just kind of decompress.
There you go. Well, thanks for taking the time this morning.
Absolutely.
Hopefully, we help some folks out. Get prepared for these doctors. Let them know how you're doing and what you want to look at.
Absolutely. Yep. Stay focused. I know it's hard, but they really only have a short amount of time. And use your nurse. Nurses are great. We can advocate for you. We're great resources.
Well, thanks so much again, Nurse Christina. We'll be right back with your morning dose of What's Trending.